to part 2 of chest x-ray anatomy. So who am I? I'm a consultant radiologist in the UK. My name is Mathuri. So in part 2, we're going to cover the topics of lateral chest x-ray, bones, and some normal variants, which is something that you need to know for your part 1 of your FRCR. So the next topic that we're going to discuss is bones. So we're going to start off with the ribs. It's important that we follow each rib in its entirety, starting off looking at the posterior rib, extending all the way to the anterior border. Now, in the chest radiograph, you've also got other bones that you can see. So depending on the coverage, you may see the proximal humerus and the scapula, so you can see the medial border of the scapula, the spine, the coracoid process. So you can see the coracoid process of the scapula, the spine of the scapula, as well as the medial border of the scapula, as well as the lateral border of the scapula. And then if we move on to the clavicles medially, you can see the sternoclavicular joint extending laterally to the acromioclavicular joint. You can identify the first thoracic vertebra by the superiorly angled transverse process. You can see the spinous process, as well as identifying the vertebral body, as well as the intervertebral disc space. So next, I'm going to move on to look at the lateral chest radiograph, another favorite on anatomy exams. So we're going to start off by looking at the horizontal and oblique fissures. So the oblique fissure separates the upper lobe from the lower lobe. So where it runs on the lateral radiograph is behind the sternum, about 3-4 centimeters behind it. It runs obliquely to the level of T4 if we were looking at the left oblique fissure, and it runs to the level of T5 if we were looking at the right oblique fissure. The horizontal fissure runs from the level of the hilum to the 4th to the 6th rib. So next we're going to look on to the borders of the heart. So the anterior border is made up by the right ventricle, and looking at the posterior border of the heart, inferiorly is made up of the left ventricle, and we extend superiorly, you have the left atrium. Next, you've got to identify the right and left main pulmonary artery. To help identify that, a useful structure to identify is the left main bronchus, which is located centrally, and anterior to the left main bronchus is your right pulmonary artery, and arching is the left pulmonary artery. Next thing I'd like to look at is identifying the left and right diaphragm on the lateral chest radiograph. So to differentiate between the right and left diaphragm, it is useful to look anteriorly, and the left diaphragm abuts the heart, and you cannot follow its contour beyond the heart. Compare that to the right diaphragm, you can follow its contour all the way anteriorly to the chest wall. Okay, so this is our final topic in looking at the anatomy of the chest radiograph. So the final thing that I want to look at is normal variance. It's a common anatomy question in the part 1 exam. So I'd like to spend a couple of minutes talking about a couple of normal variants that you may see. So the images that I have obtained from Radiopedia, and I have linked in the description so that you can look at the cases for yourself if you would like. So first normal variant I'd like to look at is dextrocardia. So the heart is located on the right hand side. It's quite useful to see where the stomach bubble is also located, because if the stomach bubble is on the right hand side, this may imply a situs inversus. Next, the right-sided aortic arch. This may, typically can be asymptomatic, or it could be part of pathology with congenital heart disease. So, right-sided aortic arch. The azygous fissure. It is typically seen in approximately 1 to 2% of chest radiographs. The azygous vein, which is lined by visceral and parietal pleura, lies in the base of the fissure, and sometimes it can actually create an azygous lobe as well. Typically, the azygous fissure has a tadpole shape. The other type of normal variance you can get is of the skeleton. So you can have a cervical rib, as well as variants of the ribs itself. So you can have bifid ribs, ribs may be hypoplastic or fused as well. And then finally, I'd like to move on to pectus excavatum. The way to identify pectus on a frontal radiograph is that you have a ill-defined right heart border, and looking at the ribs, they tend to have an oblique course, which gives them a shape like a 7 rather than the typical C shape that you see. So as I've said, the images have all been taken from Radiopedia, and I've linked the cases in the description below if you would like to take a look at that for yourself. Okay, so you've reached the end of the chest radiograph anatomy. If you want to see more content like this, you know what to do. Like, subscribe, and share.